Welcome back for this Thursday's Panhandle Health interview segment. When it's over, you can take part in a chat about it on connectamarillo.com. The subject this week is the differences between type 1 and type 2 diabetes, and my guest is Dr. Caleb Kim, who's with Amarillo's Family Medicine Center. Dr. Kim, thank you for being with us today.
Thanks for having me here.
I would imagine that some folks don't even know there are two types of diabetes. Which one is more important in your mind and why?
Well, I think having diabetes, both are important because they both present different types of complications and problems. Type 1 is what we typically know as people with kids who have diabetes at a younger age. We're not quite sure why people get type 1 diabetes at this point. They think it may be some kind of viral infection, some genetic components. We're not quite sure. But that's typically the kids who have diabetes. Type 2 is what we typically think of diabetes when older people, family history, very strong possibility also because of their weight. That's a big factor in that.
And you were telling me you have some kind of a philosophy of a kind of a diabetes 1.5, kind of in the middle of both of those.
I'm not sure if I could take credit for this philosophy myself, but we have a lot of patients who are in their 20s and 30s who develop diabetes. Initially, they do respond to medications by mouth, oral medications, but in time, it just no longer treats their diabetes, and in turn, they become insulin dependent. And that's really the big difference between type 1 and type 2, is that people in type 1 need insulin because they're not able to make their own insulin on their own, and so we give them insulin, whereas many of the type 2 diabetics are able to produce their own insulin, and they just medication to help them along.
So type 2, you can beat it with medication and with exercise and weight control, that
Absolutely.
kind of thing?
I have type 2 diabetic patients who are not on any medications. They eat right and exercise, do what they're supposed to do, and they're able to manage diabetes on diet alone.
One thing I didn't know is you can get too much insulin. It's toxic to your cells. Is that correct?
Oh, absolutely. So we have patients who hear about they took too much insulin, drops their blood sugar, and they have what we call hypoglycemic comas, and actually they can die from that too. So
can a type 2 diabetic be placed on insulin to help them along as well?
Absolutely. So ideally, we have type 2 diabetics. We want to treat them with diet and oral medication, but some people get to a point where it's not sufficient. And so for those patients, we do put them on insulin because insulin is good medicine. It's not the end of the world, and it helps them. It controls their blood sugar, and that's not a problem.
Our 2 minutes went by very fast, but Dr. Kim, thanks a lot for being with us today. In a minute or two, the doctor will begin to chat on that topic. To be part of it, go to connectamarillo.com and click the alert tab. Thanks once again.